Dr. Quinn, Happy New Year. Thank you for joining us.
Hey, Happy New Year to you, and thank you for having me.
Well,
This is definitely going to be an interesting year, and a lot of it is going to depend on our actions as a country, as a world. We have to get those vaccinations, but until enough people are vaccinated, we have to maintain the recommendations such as wearing masks, social distancing, and avoiding large crowds as much as possible.
We got to stay with the program, huh? Well, have you found that as a physician, people are now really focused on health and wellness because of the pandemic?
Most definitely. I mean, if you look at the numbers of people who have lost their lives, the vulnerable population, well, aging, that's something that you can't control. You're going to age. But individuals that are healthier, that may have chronic medical conditions, but those conditions are better controlled because of lifestyle choices such as exercise, eating healthy, taking their medications, and following all the recommendations of their healthcare providers, they tend to fare better if they contract COVID-19. And this is a message that's resonating with a lot of my patients. They're trying to become more healthy because they want to make their chances better if they do contract COVID-19 or if we have another pandemic in the future.
So I heard you talk about the vaccine already, but outside of the vaccine, what kind of things can people do to maybe improve their health and wellness going into 2021 now that we're here?
Well, here's the deal. One of the factors that gives the virus a boost as far as making you more ill is if you have increased stress. I mean, there's been a lot of research showing if you can decrease your stress, your immune system is stronger. And remember, those with compromised immune systems are the most vulnerable. So if you can decrease your stress, maybe live within your means. I mean, economics, that's one of the number one stressors. Work on your relationships, exercise, sleep, get 8 hours of sleep if you can, and just don't take on too much, just decrease that stress. That gives you more of a fighting chance if you do contract COVID-19 or any other infection.
Dr. Quinn, one last question. How do you foresee what's happening with the virus this year? What do you think is going to happen with the virus? I know we've got the vaccine, but a lot of us won't get that vaccination for a while yet.
Well, you know, like I said before, a lot of it depends on us. If we'll continue to just follow those recommendations, I mean, wear those masks, social distance, avoid large crowds as much as possible, but also when people become eligible for the vaccine, let's get that vaccine, because the more people are vaccinated and the faster they're vaccinated, the sooner we can get to a safer point for not only the United States, but for the world.
All right. Great information, Dr. Timothy Quinn. Thank you so much for being with us again today.
Thank you.